it is expected that you devise a means where you access healthcare without overflogging the income you are earning, for you to have a reliable and a comfortable means of living.
And the mandate given to the Katsina State Contributory Agency is to ensure that each and every resident of Katsina State has easy access to healthcare wherever he is in the state.
The Contributory Healthcare Management Agency is to ensure that, starting with the formal sector, is to ensure that there is a guarantee for particularly the vulnerable categories that they can access healthcare no matter the condition or day or week or month they fall sick.
If you look at this kind of initiative, it is trying to make healthcare accessible for all. And if you could remember, one of the areas where common man is feeling or can feel the impact of a government is through healthcare.
A robust financial structure can be a key determinant in healthcare delivery when people have to pay most of the cost of healthcare services out of their own pockets. This is more reason why most of the poor, on one hand, are often unable to obtain many services they require, while the rich, on the other hand, also can be exposed to financial hardship in the event of severe or long-term illness. For years, reasonable options have been tested by authorities to give better alternatives, but it appears that pooling of funds from compulsory funding services such as mandatory insurance can lessen the burden on the individuals by spreading the financial risk of illness across the population for more equity and access to all.
Most households face series of challenges due to economic downturn. This challenge has forced most states of the Federation to investigate the national health insurance scheme based on their religion, traditional values, system, and other peculiarities. It is over 2 years now since I signed into law the bill establishing the Katsina State Contributory Health Management Agency, and I am happy to mention that the scheme is designed to be one of the successful reforms in the health sector, with over 320,000 prospective enrollees in the formal sector.
First of all, we have different programs. We have the formal sector programs. We have the informal sector programs. Under the formal sector program, we have a composition of those civil servants that have structured salaries. We have those men in uniforms, those organized private sectors within the state that are eligible to join the formal sector program. What is the scope of coverage? For a civil servant, automatically you are entitled to enroll with your spouse and 4 biological children below the age of 18.
Katsina State government is rethinking about its health policies by evolving the instrument to introduce a contributory healthcare management (KTS-CHMA) as one of the single most powerful social security. Health contribution coverage and willingness to pay for health contribution among residents of the state. Social security intervention in an effort to attain universal health coverage in accordance with the health restoration agenda.
The Katsina State Contributory Healthcare Management Agency is visualized as one of the most powerful social security intervention in the state's efforts geared towards the attainment of universal health coverage.
And when we talk of universal health coverage, it's just saying that all people within the community would be able to access healthcare without recourse to any obstacle. The healthcare would be free, or even if it is not free, they should be able to afford to access it.
Naturally, all new policies may encounter teething problems, but ultimately, healthcare, contributory healthcare agency, and its own objective will ensure that healthcare services reach the common man in the least.
Katsina State Compulsory Healthcare Management Agency was established by Law No. 10 of 2018 as an institutional framework for improving healthcare financing through contributions, premiums, or taxes paid into a common pool to make accessible to healthcare services easier to all residents of Katsina State as specified by law.
We learned from other states that have implemented this policy. Secondly, from that learning process, the government of Katsina State decided to engage the services of people who are knowledgeable on contributory healthcare management. The DG was a product of the national level implementation of the policy. The chairman of the agency board that is supervising the agency is also a product of the national level policy of that aspect of healthcare delivery. So that is one. Secondly, in the process of our engagement alongside the agency management, we carry the labor along with us and the other component of unions that made up the NLC in Katsina State. We specifically in the MOU assign them a role of monitoring to ensure that what we specifically mention in the MOU of that healthcare delivery is being consistently maintained.
I believe this system of e-payment is a sure way of ensuring accountability as regards funding. And also the procurement processes that we go through, you have to do the tendering, you have to do all this. So these are all processes that ensure at least filtrage of funding or funds is minimized and the funds are utilized for the purpose they are meant for.
Once we have to have a socially responsible healthcare delivery system, there must be someone financing that. And the moment you have a funds flow mechanism, a very strong funds flow mechanism that works, then I don't think if there is going to be any leakages elsewhere, that people may even go to the extent of thinking that some of the funds, some part of the funds may be used inappropriately. The reason why I said this is most of this funds utilization, we have it in the operational guidelines. It has guided us on how we are going to spend the funds. Most of the funds, 75% of it, goes directly to the healthcare facilities. And one of the most important things is this: when it gets to the healthcare facilities, how confident are you that such healthcare facilities will utilize the funds to ensure that they provide adequate and effective healthcare services? And that is another reason why we have the Planning, Research and Statistics Department, who is saddled with the responsibility of monitoring and evaluation of these healthcare facilities. And at the same time, before we even agree to give you the go-ahead to start treating our patients, we have what we call the service level agreements. We have to agree between the agency and the healthcare facility that such funds are going to be used purposely for provision of healthcare services. That's number one. Secondly, in terms of human resource gap, in terms of the drugs, supply of drugs, the basic equipment needed to give these healthcare services, we have to make sure, or we must make sure, that you have met up to such requirements before we even give you that accreditation. And at any time, when you happen to find yourself wanting in such cases, we have the right to delist you from the program automatically.
In line with the vision of the agency, the government poised to build a strong, dynamic, responsive, contributory healthcare scheme committed to securing access to adequate and affordable healthcare for the benefit of the state. More so, the agency is determined to facilitate fair financing of healthcare costs through a credible and sustainable pooling mechanism.
What we started from the onset is what we call the baseline assessment survey, because we need to know the condition that this state is into. So from there, we had a very successful conduct of the exercise, and we found out that about 99% of the total population of Katsina State do not have any plan. And at the same time, the state civil servants, about between 35 to 45% of their income is being spent on healthcare. And that is what the United Nations calls or termed as catastrophic health expenditure. And that is exactly what this administration is trying to bring down, at least to the minimal level. We have what we call enrollment form, which is going to be submitted to the relevant ministries, departments, and agencies for them to put up their staff and ensure that they fill that form appropriately. And that form contains your details, the details of your spouse, and that of your children. So once we have that in place, it will be much easier for us to come with our gadgets and our tabs to upload such pictures electronically into the database. So such database, by the time we get it done, we are going to ensure that each and every hospital that has been chosen by the enrollees will be a register will be generated for them. So such registers are going to be used for the payment of capitation. And capitation is what we call one of the provider payment mechanisms that we have. So we pay them in form of capitation in advance. So that means by the time we enroll all the state civil servants into the scheme, first of all, we have to pay the healthcare facilities in advance for the services to be rendered to our clients. So once we pay, we ensure that whenever you go to the hospital, you are being treated very well. And that is one of the reasons why we have a dedicated department, which is called the Standards and Quality Assurance Department, which is saddled with the responsibility to ensure that qualitative healthcare services is being rendered.
The main purpose of initiative is to better services. When we look at what the state stands to benefit from, let's say, contributory healthcare system, there are so many things. Because the state, when it implements in full scale the services of contributory healthcare, one, their healthcare services will be affordable and accessible to all. Two, it will also generate funds to provide other things that are lacking in our facilities. Because if a facility is provided, let's say, basic healthcare services, which is being funded by the federal government, that facility will be given money or fee for services that the facility should render to the poor and the vulnerable people, even if they do not access the care. There is what they call capitation, in which, for example, if facility A is having 1,000, enrollees in that facilities who are to access care in that facility, the government will be paying for these 1,000 people in advance. Either they come and access care or not, that money will go to the facility. So with that money, a lot of things that are lacking today in our health facilities can be used, to reposition the health facilities in terms of infrastructure as well.
And that forms another basis for us to sit with the organized labor as representatives of the workers to determine the percentage contributions that will be generated from their salaries into the pool to ensure that we have a sustainable healthcare financing system. And that is what's made us to be in Kano sometimes last year, to sit with them and finally agree on 2.5% of the consolidated salaries of the state civil servants as the contributions. So such contributions are being categorized into 5 different subheads. The first one, which takes about 75% of the total funds, is being paid to the healthcare facilities as capitation. Then after that, we have what we call the fee for service. When you are being referred to a hospital, how do you pay for the services rendered? It is under the fee for service that we use to pay for the services rendered. Then we have what we call the administrative charges, which is naturally going to be used for the quality assurance, monitoring and evaluation, and so many other things. A enrollee satisfaction survey, and so many other activities that entails the success of the scheme. Then we have some part of the funds that is being kept aside as reserve funds. In case if something happens, you can always fall back so that you can augment any shock that can come in.
Katsina State Contributory Healthcare Management Agency was established on the 27th of December 2018 to achieve the following objectives: to promote and implement the new scheme, to promote accessibility to effective and qualitative healthcare services, protect families from the financial hardship to healthcare bills through the provision of affordable healthcare services, limit the inflammatory rise in the cost of healthcare services. Further, the scheme is designed to maintain high standard of healthcare delivery services within the health sector. This is in addition to improving private sector and participation in service provision, patronage and maintenance. As part of the activities of the agency to kickstart the scheme, it carried out series of activities including a baseline survey for implementation of the scheme. This was intended to determine household spending on health-seeking behavior, access to healthcare services, healthcare contribution coverage and willingness to pay for health contribution among the residents of the state.
Our vision is to achieve universal health coverage for all residents of Katsina State, where no one will be left behind in accessing healthcare. Hence, the need to provide a credible and sustainable mechanism for pooling of resources to finance healthcare provisions under the formal and informal sector programs. As part of the plan for implementation of the scheme, a stakeholder engagement was held to agree on the percentage contribution from the beneficiaries under the formal sector program, where 2.5% of the consolidated salary of public servants was agreed as contributions against the 35% average expenditure on healthcare according to the baseline assessment survey conducted by the agency.
We all know that ICT is the backbone of the agency. A robust ICT platform is the backbone of the agency. Why? Because there are times that someone may decide to retire on his own. So when you retire, your name is automatically delisted from the payroll. At the same time, if naturally your retirement age comes, then you have to exit the scheme. So if we don't have a robust ICT platform, you cannot be able to detect such and remove them. And at the same time, some people may decide to live in a place other than where they work. For example, now someone may decide to stay in Katsina, working in Katsina, but his family resides in Dora. So in that case, how do you do with the family? Are you going to still bring them back to Katsina just because you want them to access healthcare in Katsina? No. Our system is flexible, that you can easily choose a healthcare facility there in Dora while you choose your own in here in Katsina, so that whenever they fall ill, they get to the access healthcare easily there.
Now that the agency is set out to commence its activities proper, it is obvious that the role of other stakeholders such as the Office of the Head of Service, Ministry of Health, Hospital Services, Management Board and SPHCA, among others, are key stakeholders in repairing the gains of the contributory healthcare.
So with this thing and with the establishment of Katsina State Contributory Health Management Agency, it's also another plus for this government, because these facilities also are going to be providing services. They are, with every service, they are going to enjoy capitation. This will further boost their financial standing. They should be able to do a lot of things in terms of infrastructure. In fact, in terms of hiring additional help, if they decide they want to engage maybe health attendants for cleaning, they want to sink a borehole, these are all things that now is possible for them. And as I've said, we are trying to strike a balance between demand and supply. With coming up of this CHIPS agent, with community engagement focal persons, and with so many other new innovations, we believe that primary healthcare is going to become a very robust, and it's going to discharge activities that are expected of it. That is by catering for over 70% of the health needs of the general population.
This contributory health scheme or agency is necessary. It's a necessity in order to ensure that people are taken away from the burden of out-of-pocket expenditure. And we thank God, under the able leadership of His Excellency, the Governor of Katsina State, Right Honorable Aminu Bello Masari, this agency has fully taken up, and then will ensure following the due process so that transparently everyone will be happy with the health service delivery without out-of-pocket expenditure burdens.
Provision Fund. In line with the state policy on health system, 1% of state statutory allocation has been appropriated in the 2021 budget and dedicated to the state contributory healthcare management agency as equity fund for the vulnerable groups and the matching grant for basic healthcare provision fund, as well as to augment the risk pool of the contributory healthcare scheme. Ladies and gentlemen, the primary purpose of Katsina State Contributory Health Management Agency is to significantly reduce catastrophic healthcare expenditure among the people of Katsina State. Such will be feasible by ensuring adequate and sustainable funding that will be efficiently and equitably used to provide quality health services and ensure financial risk protection in access to health services for all Katsina State residents, particularly the poor and the vulnerable.
Katsina State Contributory Healthcare will be funded directly from the state. Monthly contributions of workers from salaries, contributions from communities through mutual healthcare associations. The provisions of the scheme on vulnerable groups is robust as it targets a significant number of this group through funding from the federal, state or local government on specific intervention programs, funding from philanthropists, donors, among others. Rights and privileges of beneficiaries and packages for formal sector are so designed to a level that will accommodate the choices and demands of enrollees to suit their purpose and number of healthcare services they require. Katsina State Contributory Healthcare Management is a scientifically driven option that is determined to promote quality and affordable healthcare services to all strata of the society with a renewed zeal to address the access deficit and all the healthcare challenges.
The state government has appropriated 1% equity contribution of the state consolidated revenue as contained in Section 19 of the law in order to provide free healthcare to the vulnerable population.
Workers of Katsina State and the entire public will feel much more comfortable.
There is commitment on the two sides. One, the state government, because of the huge investment in health sector, and two, the proposed beneficiaries.
Financing You see, it improves a lot of things. First of all, the government will have to drop down its expenditure on healthcare. And the fact that most of the healthcare facilities are now better off, they have enough funds to take care of the basic things they need, to give the adequate services to the people. So when it goes down to the grassroots, especially those living in the rural areas, we have so many programs. If we succeed in such programs, automatically it implies that infrastructural upgrade across the state is being achieved, and that automatically will attract enough manpower in the health sector. And we all know that when we have adequate manpower in the health sector, especially with relevant policies that target the particular group of people, it generally improves the well-being of the population, and automatically that will bring about economic development and social change, especially in those remote areas of the state where you even find it very difficult to access healthcare. And now maybe within 20 minutes you can access healthcare wherever you are in the state. So we hope and we believe in the next 2-3 years, any resident of Katsina State can move all around the state, and if he has any problem that has to do with healthcare, he can just walk into any healthcare facility and access healthcare, especially when at that very time we have already advanced our system of national identification number, which will definitely be part of the identification when you have to access healthcare in Katsina State in the next 2 years.